Thank you guys for joining Newsbits tonight. We're going to be looking at an interview with Dr. Fauci. As you can guess, it's going to be on COVID-19, um, primarily on the vaccinations of COVID-19. This is going to be an interview by Eugenio Derbez, who's a Mexican actor, filmmaker, and comedian. And this is not aired very much. It came out a few days ago. This is one of the only full interviews I found. I'm going to link it in the chat or in the comments, excuse me, because I really encourage you to watch the full interview yourselves. Only 9,000 views right now, but we're going to look at a couple of fun timestamps together, just to go through it. So as you can see, Eugenio Derbez really warms up to Fauci in the beginning, gives him a sense of security, and then hits him with what I would think is, the types of questions that most journalists should be asking Fauci. I think if you guys tune in the news, you start to see it's almost like a script. Every question they ask Fauci is an absolute lob, an easy question for him to answer. So, without further ado, let's jump in.
Vamos a tener ese informe. Sorry about the delay. I was trying to figure out how to make this work. Dr. Fauci, it's a pleasure meeting you.
Same here. Same here.
Thanks for having the time to talk.
All right, so he warms Fauci up a little bit. First question he's going to ask is about the official approval of the vaccine from the FDA.
For all of us to learn and to understand about the vaccine. So, first question, which of the COVID-19 vaccines have been officially approved by the FDA?
3 of them. One from Moderna, which is the mRNA.
Then he talks about the 3 vaccines, Moderna, Pfizer, and Johnson & Johnson. He talks about the 2 mRNAs, which are the first one, and then that third one is that, dead virus. He falls into the trap here because in just a minute, Eugenio talks about, these really aren't FDA approvals. They're emergency authorization orders.
I asked if it was approved by the FDA, but I think that it's a different thing an emergency use authorization than an approval. So what is the difference between an emergency use authorization and an official approval by the FDA?
Yes, that's a very good question. So an emergency use
looks like a little bit of a tell. Fauci doesn't look so happy. Just body language. I think he does a good job at interviews in terms of composure. But his tell is that's a good question. When he says that's a good question, I believe that it's a question he doesn't like to answer. Draw your own conclusions. But, this is a little bit of my commentary today on this interview. So we're going to go forward. They talk about the difference between an approval and an emergency authorization order. And then the next change of topic is at about 6 minutes. And they talk about medical and legal responsibilities, suing the manufacturer. So let's look at the circles that, Fauci kind of walks or talks through.
What about the long term? I mean, what is the medical and legal responsibility of the companies that are making the vaccines? What happens if secondary effects are
You can see the body language with Fauci there.
seen, let's say, in 5 or 10 years? Can I sue the manufacturer of the product if it hurts me, or if there's long-term effects years down the road?
There is a fund that allows the compensation for injury. But I have to tell you, Eugenio, that it's very, very, very unlikely that you're going to have an effect 5 or 10 years down the pike. The reason we say that is that we have decades of experience in the field of vaccinology, and virtually all of the effects, if they even occur, and they're very rare, occur within 15 to 45 days following the dose. And one of the stipulations of the emergency use authorization is that they don't allow it to be given to people until 60 days following when half of the people have gotten their last dose. So they're adding some cushion time. So that's the reason why, even though we had the data that indicated that it was safe and effective, each of the companies had to wait 60 days before they were able to release it to be given to the people, because the most of the bad effects, if they do occur, and I say it's extremely rare, they almost all occur between 15 and 45 days.
Yeah, I'm more concerned about the long-term effects. honestly. So, and
Well,
that's what I ask about if I can sue a manufacturer, but because governments around the world are taking the liability, governments, but I'm
right.
talking about the manufacturer. If there's a problem, can I sue the people that made the vaccine, not the government, the people that made the vaccine? Because I've heard they are protected from liability. If they're not willing to stand for their product, or if I can't sue them, does that mean they're worried it's going to hurt people?
They are very sensitive about hurting people, but you can sue anybody you want to sue. There's no guarantee because it will be in a court that would decide whether or not you get compensation. But
But
we have not had any issues with that in any of the other vaccines. So I would be really surprised if that's the case.
So at this point, he's kind of talking in circles, not answering the question. The question is, no, these companies do have immunity from, liability of these vaccines. And, I encourage you to do some research on your own. But you can just see Fauci kind of circling around this question. So they're going to keep talking about this for a bit. Fauci's itching his neck. We're going to go to the next question, and that's, what is the reason for taking this vaccine? What is this herd immunity thing?
I heard that the reason people should take vaccines is to create herd immunity. What is herd immunity?
Well, the first reason to take the vaccine is to protect yourself, your family, and your community. Herd immunity refers to a situation where you have a high percentage of people who are vaccinated so that when the virus enters the community, there are so few people to attack that the virus has a difficulty in propagating itself. And by herd immunity means you get an umbrella of protection because so many people are protected that when the virus comes in, it spreads only when there are a lot of vulnerable people. But if a certain percentage of the people are protected, like with measles, if you get 90% of the people vaccinated with measles, 91, 92%, when you get measles introduced into the community, it will not spread. But if you get down the level to in the 80s, there's enough vulnerable people that the virus can spread. They use the word herd. You know what it refers to? You ever see when you look at the movie pictures of Africa where you see the herds of wildebeest and the lions are trying to get to them, and you have all of the adult wildebeest around, and the weak ones, the older ones or the babies, they're in there, but there are a few of them. The herd protects.
Then he gives a explanation on herd immunity. The next question up is, will undocumented people in America be able to get the vaccination without legal repercussions? Fauci affirms that that's a yes. I don't think that's as interesting of a question as the next one. And this is when Eugenio, and I'm saying his name awfully, so excuse me, Eugenio, because you're asking great questions. But he asked, do healthy people need to take this vaccine too?
Themselves very healthy. They say they don't need the vaccine. But I've heard that even if healthy people have a very low risk of dying from COVID, they should still get the vaccine so they don't spread the virus to people who might be too old or too sick to get the vaccine. Is that true?
That's absolutely true. So an example, if you're a young, healthy person, statistically, the chances are that if you get infected, you're not going to get seriously ill. The people who get seriously ill and die, and I must point out, as I think you know, already there have been 525,000 deaths in this country.
You got to put the fear mongering there. Didn't seem like he was really trying to convey a fact. He was really stressing that deaths part. So we just heard right there that you got to get the vaccine to stop the spread. So now we're going to skip a question and go to the next question. At 1538, he talks a little bit about what the vaccine actually does. And now let's look at Fauci's question or answer right here.
To stop the clinical disease or the symptoms is different from getting the virus, the infection, right? So basically the vaccine lowers my symptoms, but it may not prevent me from being infected with SARS-CoV-2, which means there's a possibility that I can still spread the virus even after I receive the vaccine.
That's
correct?
the reason why right. That's the reason why we ask you to wear a mask after you've been vaccinated. But the evidence is accumulating that the level of virus in the nasopharynx is very low, and it is unlikely that you would transmit it. But just to be sure, we're saying wear a mask. In the next
Hmm.
couple of months, we will get enough data to be able to prove whether or not, if you get infected despite the fact that you're vaccinated, proving that in fact it is a very, very low risk that you would transmit it to someone else.
Yeah, but because I've been reading, and I saw that you stop getting the symptoms, but you still can get infected and you can still spread it. So
Right.
that was so. Uh, the main aim of the vaccines, if they neither stop you from getting the virus or transmitting it.
Right. The main purpose of the vaccine is to prevent you from getting sick, going to the hospital, and maybe dying. That's the main purpose of the vaccine.
Okay.
The main purpose of the vaccine in general is to prevent you from getting clinical illness. We believe that when all the data come in, we will prove that it also prevents you from transmitting the infection to other people.
But not yet, right? That's what I suppose you keep telling everyone they need to keep wearing the mask even if they get
Absolutely.
vaccinated. So
Absolutely, that's true.
tell me, Dr. Fauci, how come we still need to wear masks? I believe totally in masks and social distance, but how can we still need to wear masks after being vaccinated? And other question, under these circumstances, when are we going to go back to normal? Are we going to stop?
This is where some of the questioning and some of the answers I think get pretty interesting. In about a minute, Fauci says this is what you can't do. And it's interesting to see what his take on what we've been doing is.
Using the mask someday?
Absolutely. Absolutely. And let me tell you what you can do right now. If you are vaccinated and you are with a person who is also vaccinated in the setting of the home, if you're with your mother, your daughter, your wife, your friend, if you're with people who are also vaccinated in the setting of the home, you don't need to wear a mask and you can have.
So how many of you guys are wearing a mask right now with your husband or wife or, you know, son or daughter at home? Because I mean, that's telling me he's a little bit out of touch if he thinks that people that have not been vaccinated are wearing masks at home with each other's family members. I mean, I'm sure that has been happening in some households, but I think that's absolutely ludicrous. I think that was probably the motivation for making me post this video.
Physical contact. You can hug your children, you can hug your mother or your father. You can do that if everyone is vaccinated. Even
Okay, all right. We'll let you guys watch it on your own if you're interested. I'll link this exact video in my comments. Next question is a question about the mRNA vaccine. It's gonna be at 22 minutes. And there's sub questions in here, but I'm trying to break it up to the new topics. Feel free to watch on your own.
we won't know exactly how much until we follow these people for a considerable period of time.
Okay. And now, Moderna and Pfizer are both mRNA vaccines.
Correct.
Has this kind of mRNA vaccine technology ever been injected into humans before?
Well, this is the first time, and the good news is that the results are really, really good.
And the good news is that the results are really, really good. I think that's just a funny response. He's compensating for something. At 240 or at 2440, Eugenio asked about the Catholic community and how the Johnson & Johnson vaccine used some fetal cell tissue to generate or derive their vaccine. Now we're going to go to 2545. And this is another question. And what the question here is, if the death rate for children is so low, do you need a vaccine for children? And Fauci, I think you guys can guess. Answers yes. And then they talk a little bit about, school policy. So we'll give this another minute and change. Watch one more little clip of this and then conclude this video so you guys can have more time to watch this on your own time.
It's is extremely low. Do they really need the vaccine? Are they going to vaccine kids in the future? Is it going to be mandatory?
But in order to be able to completely crush this outbreak, you want to get as many people, including children, vaccinated as you possibly can. Because when you do, you will get such a broad protection that you could eliminate this virus. And that's what we're trying to do. Also, even though children unusually can get a serious outcome, some children do get very seriously ill when they get infected. And that's the reason why you want to vaccinate them. Not only to protect them, but they can be the vehicles of spread of the virus to other people.
Is it going to be
And we know they still can, even with the vaccine, as he just said a couple minutes ago.
mandatory at school? Because my daughter, when I enrolled her into school, it was mandatory to have all the vaccines.
Right.
COVID didn't exist back then, but is it going to be mandatory at schools to have the COVID vaccines?
I can't say that it is or won't. It is certainly conceivable that it might ultimately turn out to be mandatory. But right now, nothing we're talking about is mandatory. In the future, it could be similar to the measles, mumps, rubella, and the hepatitis and meningitis, all of which are required if you go into a public school. Right now, there is no mandatory anything about it, but someday it might be.
And he's priming us at that point for, introducing the possibility that this will be mandatory at some point. And I think that's an end game that a lot of people have been seeing. And I think that will be an interesting end game. So we talk a little bit about variants at 27:30. So they're going to segue into that in the next minute. I just want to show you a funny line. Fauci seems to mix. He has a different take on what confidence means. He seems to replace it with a term, doubly sure. So we'll hear him, very academically answer with the term doubly sure for the concept of boosters, which is going to be a third shot or maybe even a seasonal shot of this COVID vaccine.
Very, very good at protecting you from getting seriously ill.
And this third booster shot that they're working on, that says to me that probably they're not confident that the two shots are going to be good enough. Does it mean that the vaccine doesn't work against variants?
No, they're not saying that. They want to be doubly sure in case they have to give a booster. They want to determine what the effect of that booster is. So in order to be doubly sure, we're proceeding with studies to see what happens when you give a third shot. That has nothing to do with being confident or not confident. It means you want to be doubly sure that you're covering all the bases.
And we're going to close it there. Big difference in confidence versus doubly sure. Look it up. You should know that already. But anyway, guys, thank you for joining in on this. I'm going to post the interview in the description. I think this has just been an awesome case study of Fauci getting asked some tougher questions than what they've been asking on the the mainstream media. So thank you guys for joining, and continue to draw your own conclusions. Don't let my commentary and my bias, sway you one way or another. But please stay curious. Thank you guys. Take care.